Welcome. Thank you for taking the time out of your day to be with us live, or if you're listening in on demand, as we continue on the series of the Heart of Rural Nursing in South Dakota. Before we get started today, just a few reminders. When you join the session, you will automatically be muted. We do ask that you keep your mute button on to reduce any background noise and feedback during the presentation. At any time during Q&A, which is held throughout the presentations, you can feel free to unmute your button rather, to ask your question. Alternatively, you can also feel free to use the chat feature and we can field that question or comment for you. Please do keep your video on at all times. And when you are speaking, we do ask that you maintain confidentiality. In order to support the growth of the ECHO movement, Project ECHO does create data for tele-echo program, excuse me. We are looking forward to you sharing today, so please do make time to contribute to the conversation, share your knowledge, ask your questions, and introduce yourself when you are joining the presentation. By way of introduction, I am Stacy Villano, if I haven't had the pleasure to meet you, and I am the marketing and communications, as well as some admin support for the Global Rural Nursing Exchange Network, or GRNEN. And GRNEN exists to connect nurses, students, and educators who share a passion for improving the health of rural communities and appreciation for the role nurses play in serving these communities. We are a global organization, and we provide various levels of education, webinars, and serve as a means by which to connect people in our global rural communities. Our partnership with the University of South Dakota allows us to bring these real life experiences that the nursing students who are participating in the HRSA program have to our global audience, which really helps us show how powerful these testimonies are, how common and similar the work that people are doing in rural communities worldwide are, as well as to demonstrate the differences in order to gain an appreciation for everything that we are doing, and hopefully also encouraging interest in other students to pursue careers in rural communities and encourage educators to bring these opportunities to the classrooms so that way their students have some familiarity with what it's like to benefit from being in a rural community. I have the pleasure of introducing your presenters today. Helene Heggie has practiced nursing for over 35 years. She has practiced in many different clinical areas, including as the primary RN in a rural clinic for 10 years. While working at the Rural Health Clinic, Helene obtained her Master's of Science in Nursing Education. She has been a nurse educator at the University of South Dakota for the past 10 years. Along with Helene is Katie Franson, who is an instructor at the University of South Dakota in Vermillion. She has been a nurse for 14 years. Katie has worked in a rural health setting and contributes to work PRN in Critical Access Hospital. Katie is the coordinator of the USD Nursing Lab and Simulation Experiences, and she is also the co-lead of the USD HRSA Grant Experience. So with that, I would like to turn it over to your presenters as they continue the discussion today.
Great, thanks, Stacy. So we're going to be continuing on with our series here, but just to tell you a little bit about how we came to do this. We were awarded the HRSA grant. The USD was awarded the HRSA grant back in fall of 2022. We were awarded $1 million for 3 years, and there are 2 parts to this grant that we meet. One is recruiting to the nursing profession, especially the Native American population, and getting more nurses. So that's the first one, and then getting more nurses out into workforce with doing that. And then other side is our clinical part of that. So with the recruiting side of it, our team has been visiting schools and hospitals, holding fairs, and attending events. Every year, the grant specifies that we visit the tribal nations 2 times throughout that year. And there are 9 tribal nations throughout South Dakota. To meet the second objective of getting more nurses out into that rural area, we've been placing our nursing students out in rural hospitals for clinical experiences across the state. They complete 135 clinical hours in that facility and immerse themselves into the community that they're in. The students take a survey before and after this experience, and to date, we've placed about 70 students in those experiences, and all of them have reported an increased knowledge and interest in rural health nursing. And we'll go to the next slide there.
So now we're going to talk a little bit about South Dakota, and we start by talking about its location. And we understand that we do have a global community that's listening to our conversation that we're having today about health and rural health, and specifically rural health in South Dakota. So we're going to look, the X is approximately where South Dakota is related into the United States, which, as you all know, the United States is in North America. But it kind of puts into perspective how unique our culture is, and really how big the world really is, and how every little community has its own needs that have to be met. And fortunately, we as nursing students have the opportunity, and nursing faculty, we have the opportunity to affect the health of all. So it's kind of an exciting aspect to see it on a global aspect. Next slide, Stacy. So South Dakota, again, there's a little X kind of on part of our state. It's in the center part of our nation of the United States. South Dakota, we call it the Midwest, and it is very close to being in the center of the United States. We have different climates here in South Dakota. We have definitely get to celebrate all 4 seasons of the year. We have spring, summer, fall, and winter weather. We have noticed here in South Dakota that our seasons have changed a little bit with the different timings of it and different aspects of it, such as this fall. We've really had a very balmy fall so far, and haven't really entered the winter setting yet, even though we know it will be coming soon. But we enjoy every day that we have this warm weather right now. Next slide, Stacy. And so this is a map of South Dakota, and this shows all of the critical access hospitals in South Dakota. And the red X's are where all of our students have been so far. Now, as Katie shared, we do have 1 more year of this grant. We're hoping it can be extended, but over the next year, we really want to get out to all the rest of our rural access hospitals in South Dakota. And we do have plans. We have a student over Christmas break that is interested in going to Clear Lake. And so we'll continue the grant over Christmas break and then into the next semester and into the summer. So we're hoping we can put where all the blue dots are, we're hoping we can put red X's there and have students at all the critical access hospitals throughout the state of South Dakota. When we talk about our state of South Dakota, as many of us are familiar with, those that live here, but those that are not familiar with it, on the western side of the state, there's a mountain range, and it's the Black Hills, and it is where Mount Rushmore is located. On the western side, you can kind of see the western by Deadwood, Sturgis, in that area. There's the second largest city in South Dakota is located in that area, and that is Rapid City. On the eastern side of the state, below the Del Rapids X, there is Sioux Falls, South Dakota, and Sioux Falls is the largest city in the state of South Dakota. South Dakota is split in half by an interstate that goes from Rapid City to Sioux Falls. And then also there's an interstate on the eastern side of the state that goes from, as you can see, Sisseton at the top, and it goes down near Vermilion at the bottom. It goes through the state too. And those are international highways that travel throughout the nation. So we do have two of those. So there's a lot of traffic that goes through the state of South Dakota. In the center there's a plains land where there's open range land, also a lot of farming ground as well, and also pasture land that may be non-farmable, but yet can be range area for livestock. South Dakota is really a unique state by having those different demographic areas throughout the state. So it really depends on which side of the state you're on as to what the ground looks like and what the community, if it's a farming community or if it's more of an urban community, it really depends on which area you're in. There's a wide variety. Next slide, please. So today we are talking, so this whole session, as Katie mentioned, is talking about social determinants of health. And I know everyone knows this, but we're just going to remind everyone that social determinants of health are non-medical factors that affect the health outcomes. And it's very interesting. We've gotten different feedback from our students that have done this HRSA grant experience in a rural community. And one of the things that students have said is, I never quite understood what social determinants of health really meant until I was in a rural community. And now I really do understand about how those different variables can affect the health outcomes of the community. So some of the different things are the socioeconomic status, the geographic location, access to education, and just access to healthcare, how the neighborhood is, and again, the economic stability. And that is what we are focusing on today, is that economic stability. Economic stability, there's a wide variation of economic stability throughout the world. And here in South Dakota, we may see we have a homeless population, which is a reflection of that socioeconomic stability. But in the rural communities, there is some homelessness, but the other economic status really includes some key issues, such as poverty, unemployment, food security, even housing stability. And so these are different things that can affect how people prepare even for disasters and respond to emergencies, as well as affecting the general health and access to health care. So economic stability is very, very important, in reflection to health outcomes, and is related directly to health outcomes. And so we're going to be talking about economic stability in the rural communities of South Dakota and how that relates to the health and access to health care, as well as some of the unique characteristics of economic stability in rural South Dakota. Next slide. So today in this ECHO session, it's an all teach, all learn. So this really isn't a presentation that we're having. This is a conversation that we're all having. And so any experiences that you have had in your clinical setting or anywhere in the area that you live, please share those experiences with us, because we really want to get a feel for how the health access is in South Dakota and beyond. So these are our objectives of what we're going to do today. So we are going to examine the various health challenges faced in rural communities of South Dakota. We're also going to discuss how financial instability may limit access to health care, proper nutrition, and other essential resources. And then we're going to analyze the distinctive financial challenges faced by members of rural farming communities in South Dakota. Next slide. And so now we're going to be looking at the specific case studies of the students who participated in the HRSA grant experience. And so on to the next slide. It is my privilege to first introduce to you Madison Schmidt. Maddie grew up in Harrisburg, South Dakota, and she will begin her career as an OB nurse. And she has plans of practicing in Sioux Falls and plans on cross-training to the NICU. Maddie says that the HRSA grant was a wonderful opportunity for me to open my eyes to the side of rural health nursing. And this opportunity also exposed me to a diverse group of patients with varying diagnoses, which helped me understand the complexities of rural healthcare across the lifespan. So, and she also is very grateful for her time. And Maddie was at the Prairie Lakes Healthcare System in Watertown, South Dakota. So Maddie, we're going to move on to the next slide, and I'm going to turn it over to you to share with us your experience at Prairie Lakes Healthcare System in Watertown.
Awesome. Thank you. So, hi guys, my name is Maddie, and I had the opportunity to do my preceptorship at Prairie Lakes in Watertown. So, Prairie Lakes serves a 10 county region of northeast South Dakota as well as western Minnesota. Their facility is made up of 81 acute care hospital beds, which include labor and delivery, telemetry, critical care, as well as a general med-surg hospital unit, which is the unit that I was on. Their hospital services also include a 24-hour emergency department. They have surgical capabilities, interventional cardiology, as well as services that provide diagnostics and imaging services. Also, something I think that's really cool to point out is how many specialists they have. They have providers in over 31 different specialties, some of which include ENT, cancer treatment, dermatology, hospice care, nephrology, orthopedics, and the list can really go on and on. They're very well versed in that manner. Watertown is a rural community located in the northeast corner of South Dakota. It is within Cottington County, and it's nestled on the Big Sioux River, and it's actually located between two lakes, which is Lake Campeska and Lake Pelican. The population is a little over 23,000 people. A lot of the population is members of the farming community as well as other industrial trades. It's also home to Lake Area Technical College, so many students live in the area of Watertown. Because of all of the adequate resources available, the amazing environment, but still having that small town feel, Watertown is home to many young families, as well as people who have lived there all of their life. They have a lot of wildlife and recreational activities, clean green spaces, and safe neighborhoods that draw many people in. They also have a relatively low crime rate, which makes a lot of the residents of Watertown feel safe. And then next, I know a big aim of our presentation is that economic stability. And I found that the cost of living in Watertown, South Dakota is significantly lower than the national average. So the total costs when you look at housing, food, childcare, transportation, healthcare, and some of those necessities for a single adult in Watertown is around $32,600 a year, which is less than the annual cost of living in South Dakota and also less than the national average, which is around $38,400. Something I think that's important to note is that there's many barriers that may increase the risk of poor health outcomes, and that is limited access to quality health care. However, Prairie Lakes Hospital provides quality access to health care close to home. Something really cool that they have on their door right in their facility that I always took note to. It says that it's the largest privately owned healthcare facility in South Dakota, yet it's still considered rural. So I think that's something that's really just cool and something to be really proud of for them. So during my time at Prairie Lakes, I had the opportunity to take care of patients really all across the lifespan, from babies who are 6 days old all the way to elderly patients, and kind of working with end of life care. I got to help address both acute and as well as chronic conditions, take care of many post-surgical patients, and then understand some of the impacts that those rural communities do face. Some trends that I identified during my preceptorship included some mental health issues such as anxiety and depression, some substance abuse, diabetes, COPD, as well as hypertension. I am just, I think this experience was really eye-opening to me because I've only ever worked as a patient care tech in a big urban facility like Sioux Falls, as well as received my own health care there. So I now have just a greater appreciation for kind of all of these social determinants of health that we talked about, and understanding how they create barriers and some of those barriers that rural populations face in accessing that quality health care that we all deserve and need.
Thank you, Maddie, for sharing that information. So when we look at this population, though, 23,000 people, I mean, that's a pretty major city here
Yeah.
in South Dakota. So were the patients that came to the facility from more recluse areas, surrounding rural areas? And what did you see about that in your practice setting?
Yeah, so I would say there was, there was still some of your Watertown residents, but a lot of people came from, 50 plus miles away to receive their care. Watertown was kind of a central hub for many of those counties. I know, like Sisseton, which we kind of, when we were looking at the map, which is north of Watertown, there is a reservation located near there. And a lot of people from Sisseton came to Watertown to access all of their OB care. That was something that was really interesting, as well as, some of those Southwest Minnesota areas like Canby, Dawson, all of those smaller ones. So Watertown really acted as a central hub for many other smaller rural communities in the area.
Maddie, did you notice that for the patients that did come from these other areas, were they still doing all the preventative care, or did you see them more that they weren't following up maybe as often as they could because of the distance traveled?
Yeah, I definitely would say that they weren't accessing all of that preventative care. And so when they did come to us, it was that their condition had really progressed a lot further. For example, I saw a lot of um, diabetic foot wounds that had progressed extremely far, to the point of like needing an amputation because they weren't able to get that preventative health care and help manage their diabetes properly.
Maddie, how did you feel the economic stability? You kind of overviewed the economic stability of Watertown, but how did you see it in being immersed in that community? Was there a homeless population, or what kind of economic things did you see?
I guess not necessarily in my experience. I never saw a homeless population. I think that from some talking, I guess, between nurses and some people there, they said that Watertown was an expensive place to live. But then kind of when I was looking up this stuff, I kind of came across that. So there was kind of some back and forth, but I mean, they had very nice buildings, a very nice downtown. Everything was very like well kept, it seemed when I was there. So,
All right. Are there any other questions for Maddie? All right. Well, we will move on to our next clinical experience. So next I will introduce to you Mason Temmie. Mason graduated from Lenox High School in Lenox, South Dakota in 2021, and he will graduate with his BSN in December here from USD. And after graduation, he'll be working full-time at the Avera Behavioral Health Hospital in the Child Adolescent Unit in Sioux Falls. His HRSA experience was very eye-opening, and he had a lot of great experiences while he was at the Canton Inwood Medical Center in Canton, South Dakota. He also attributes to his great experience to an outstanding preceptor that he had during the clinical experience. And he said it went by very quickly because they stayed very busy during his shifts. And he also said it was a great experience. So thank you, Mason, and we'll now turn it over to you.
Yeah, thanks for that introduction. As you said, I was at Canton Inwood. It is a critical access hospital, and I know we've kind of talked about that before, but for anyone who might wonder what that is, it's a small rural hospital that provides 24-hour emergency care with limited inpatient services. So I think it was kind of cool that Maddie got to go first and got to see kind of the, I guess, larger side, if you will, of the rural health, because Canton is a town of about 3,000 people, so about 20,000 less. And there was only 12 beds at the inpatient part of the hospital, and then they had the emergency department as well. I got to work overnight shifts throughout my experience, and it was very interesting. I feel like some people might think that overnights are kind of laid back and there's not much going on, but we stayed very busy all the time, especially through the emergency department. This Canton is located just off of Interstate 29, as you talked about earlier, along the east side of the state, and it is a small town, so there's a lot of surrounding farmland, lots of corn, lots of beans, and so a lot of the people that came in were farmers. And as the stereotype goes, if a farmer comes in, it's pretty serious. And sometimes stereotypes are like that for a reason. It's because it's true. When the farmers came in, it was a head laceration or lost a digit on their hand or something along those lines. And so got to see and experience a lot of different cases with farming injuries and just elderly patients as well attached to the hospital. There's I think there was 24 rooms of a nursing home there, and so if there was ever any complications with those folks, they would just send them on over, and we would care for them for however long they needed before we sent them back there. And then another interesting aspect of it was that the Keystone Treatment Center is in Canton. It's about a mile away from the hospital. It is an addiction and rehab center. And so people come from all over the state to go there to get help that they need with addictions and treatment. And unfortunately, a few of our patients had walked from Keystone to the hospital because they thought they needed help and came through the ED. And so it was difficult to kind of play that part out when you're talking about focusing here on the economic side of things and how insurance works with that. I'm not an insurance expert by any means, but a lot of them didn't have insurance. And so they thought coming through the ED would kind of wave that away. And so we had to tell them a lot of explaining between what deserves an emergency department visit and what deserves just coming into the clinic during the day. And so that part was tough to navigate, but it was good experience to see that, because if that's happening in a town of 3,000 people, I know that's happening everywhere else in the world as well. And so just really good experience there working overnights, a lot of different cases. And like you said, it's very, very small, very rural, and a lot of farmers coming in. The difficult part with the farmers coming in is most of them are self-employed. So then going back to that insurance, a lot of them don't have it. So navigating the cost of that, and farming is both sides of my family farm, so I kind of know a little more about that, but farming is very dependent on how well of a year you have for your income, depending on the yield of your crops. And so if it was a poor year, then farmers are even less likely to come in because they don't want to spend the money that they already are making less of. And so there's a lot of gray area there, but it was very good experience to see and kind of learn how to communicate with all different kinds of people.
Thank you, Mason. I just have one question. So you talked about, so when a farmer comes in, it's really bad. So what do you mean by that?
Well, I won't say any names or anything, but a farmer came in, it was about 3 o'clock in the morning, and he had about a 5 inch laceration right above his eyebrow, and it was pretty deep. We almost had to airlift him to Sioux Falls because they didn't know if we were going to have to debride the wound or anything. But he had gotten up early to start chores, and it was dark still and not great lighting, and he had slipped and fallen off his tractor and cut his head open. And so that is another interesting thing, is that if they don't have a lot of resources at this hospital, there was always only 2 RNs on staff at most because of how small the inpatient was, and then one of them would just have to kind of float down if somebody came through the ED. So yeah, we almost had to fly him to Sioux Falls to debride the wound, but they ended up deciding that it was they had cleaned it out well enough where they could just stitch him up, and I think he ended up with 36 or 38 stitches in his head, so pretty serious.
Yeah, it is a dangerous profession. And also, as you talked about the economic side of it, that there may not be the money, or if they do have insurance, there may be a really high deductible, like a 5,000 deductible, where the insurance doesn't kick in until you met that deductible. So, yeah. Right.
Mason, I just had one question for you too. What kind of education did you do for this population, and what kind of resources did you, if you saw any that were offered, whether by the nurses? I'm guessing social work maybe wasn't there overnights, but what kind of resources and stuff were offered to these patients?
So education was mainly the difference between what deserved a clinic visit versus what deserved coming into the emergency department. So that consisted of, like, your clinic visits would be your sore throats or flu, and um, not to say that they're less serious illnesses, but less emergent illnesses, versus your emergency department visits would be like their lacerations or animal bites or things of that nature. And then the resources, Canton is just a quick trip down the interstate to Sioux Falls. And so a lot of the things that we told them were located in Sioux Falls, different, whether it was rehab or outpatient treatment, that if they needed continual care more than what this hospital could give them. So a lot of that was kind of handed to the Sioux Falls area from there.
There is a question in the chat box here. And when you talked about the education about an emergency department visit or clinic visit, the question is, were they turned away at all?
We didn't turn anybody away when I was there. It was the doctors were kind of upset for them coming in, but they treated them still. It was
Yeah.
Sometimes it was more of a scolding if there were the frequent flyers kind of coming back to the ED again and again. More of a scolding, saying this deserves a clinic visit. Like, we've talked about this before, you know this. But when I was there, they didn't turn anybody away. Everyone was treated who walked through the doors.
Good. All right. Thank you, Mason. Well, now we're going to move on to our next clinical experience. And Erica Stockdale is from Rosemont, Minnesota. And she was at the Monument Hospital in Spearfish, South Dakota. And Erica said it was a really great experience with lots of hands-on learning. And after graduation, she plans to move to the Twin Cities in Minnesota and to work in the ICU at United Hospital. So Erica, I'll hand it over to you.
Okay, thank you. Yeah, so I was at Monument Hospital in Spearfish, South Dakota. Spearfish is located on like the far western side of South Dakota in Lawrence County, and it's about 50 miles from Rapid City on I-90. Um, Spearfish ha Sorry, I have a cold right now. Spearfish has a population of 13,282, so it's the 10th largest city in South Dakota. Um, it also attracts a lot of tourists because it's home to a lot of waterfalls. It has the scenic drive, the Spearfish Canyon. It's really close to the Black Hills, and then it also is right next to Sturgis. So that August Sturgis rally, we saw a lot of bikers come through. Um, so Oh, it also has the Black Hills University, so it brings in 4,000 students every school year. Um, Monument Hospital is a 35-bed acute care hospital, and it services the surrounding communities of Brute, Harding, Meade, and Pennington in South Dakota, and then it also services Crook and Weston counties in Wyoming. Um, some of the services it includes is the inpatient, it has a labor and delivery, ICU, and then a 24-hour emergency department. Um, it does surgeries. We saw a lot of orthopedic surgeries, so hip and knee replacements. It has OBGYN surgeries and then ear, nose, and throat. Um, for more critical care, patients would be either flown or driven to Rapid City. Some of the concerns that I noticed while I was there are their lack of mental health resources. We saw a lot of mental health cases come through, especially in the emergency department. Other concerns would be like poor nutrition, substance abuse, diabetes, and then just like the distance of travel it takes to get to that hospital, since it does service so many smaller communities surrounding it. Spearfish or Monument also doesn't have a pediatrics unit, so a lot of the peds patients that came through our ED, if they needed to be admitted anywhere, they'd have to go to Rapid City, which again is that hour drive. Some of the statistics I looked up for their economics is they have a 12.3% of poverty rates and 16% experience housing instability, 7.7% experience food insecurity. So these barriers kind of contribute to their ability to access healthcare there. Um, a couple cases, people would come through not having health insurance, and like Mason said, they would use the emergency department as their primary source of healthcare for things that could have been dealt with at a clinic, and the emergency department is obviously going to be more expensive. Um, I was fortunate enough to experience all of the units at this hospital, so I did get to see labor delivery, ICU. I was on the med surg floor a couple days, but I did spend the majority of my time in the emergency department. So it's a lot of great learning experience.
Thank you, Erica. Question for you. You kind of brought up the peds patients in there. Did you, and a lot of these patients not having health insurance, were you able to see, were a lot of them on Medicaid, up to date on like the preventative vaccines, those kind of things? Did you notice any of that stuff, or were these patients just coming in kind of as a result of maybe not having some of that preventative care?
Yeah, so a lot of the older patients that we took care of, they'd come from nursing homes and be admitted to our med surg floor for things like UTIs and like dementia and different just complications. Most of them were on, yeah, the Medicare, Medicaid. Um there was one guy that came through our emergency department and he just needed a refill on his asthma inhaler prescription. And so we were able to educate him on a free clinic nearby that he could go to because he didn't have a primary care provider. And then just kind of some of the things that he was young, so just educating him on like this is how the healthcare system works. Like these are some of the things that could benefit you rather than visiting the emergency department for just refills on prescriptions.
Great, thank you.
Thank you, Erica. Well, we're going to move on to our last student experience. And Katie Shutt is from Laurel, Nebraska. And Katie will be graduating in December from USD Nursing. And she plans on working on a cardiology unit at Sanford and Sioux Falls. She had a great HRSA experience at St. Michael's Hospital in Tyndall, South Dakota. And she got to work in the ER, outpatient services, and worked with some emergency cases as well. She also did a flu shot clinic for a day, which is preventative health, and then also a foot care clinic as well for another day. And she learned about rural healthcare and the resources it provides to the community. So Katie, we'll hand it over to you.
Hello, I'm Katie. I was in Tyndall, South Dakota at St. Michael's Hospital, and it's a very rural community located on South Dakota Highway 50. It's at the bottom of South Dakota. The population was 1,075, so very small community. They had one school K through 12th grade, and then they only had one park, and then a downtown, a lot of small businesses there. The hospital I was at was connected to their clinic, so the lab and all the x-rays and diagnostic testings was shared between the clinic and the hospital. And then I was on the hospital side, so we had a 25 patient bed, 24-hour ER, a monthly foot clinic, those diagnostic services, a wound care clinic, and then outpatient and rehabilitation services. The majority of patients I got to see in the inpatient setting were a lot of swing beds. We got to take a lot of cases from Yankton or Sioux Falls that lived in a closer area. There was a lot of surrounding communities like Tabor and Springfield, so those patients would come to Tyndall for a swing bed and get their rehabilitation, do physical therapy and occupational things. And then the outpatient, we got to see a lot of like IV medications, injections, catheters, and then the 24-hour ER. The nurses worked in all these settings on the hospital side. We had 2 to 3 nurses there the whole time, and then we usually had one patient care tech. When I was there, it ranged between 1 to 5 patients in the in-care setting, but the ER was fairly busy. We usually had around 7 to 10 ERs a day. They did have a contract with Springfield State Prison, so any emergency cases from there we took, and that gave me lots of experience with that kind of social determinants of health. Um, the prison obviously provides the insurance for them, but the biggest challenges with those patients is when they would come in for emergency cases. We would have to do their discharge planning, and their discharge was definitely based on the prison's resources. So we had to kind of adjust our resources there and not only educating the prisoners, but educating their medical staff there on how the treatment was supposed to be done with them. And then we got a lot of telehealth opportunities there. I know Maddie talked about a lot of specialty cares in Watertown, but in Tyndall, it was a very, very rural community. So all the practitioners were family practitioners. So they did have many telehealth services for any specialty cares. They had servers in the ER that connected to a Vera McKinnon, and then we did have a telehealth machine that I got to kind of see go around to patients. They worked a lot with like infection control and stuff like that. They would call a Vera McKinnon's infection doctors, and we would get to see that. Yeah, and then we had a lot of rural cases. I know Mason talked about a lot about the farmers. I was there during harvest season, so I did get to see a couple harvest accidents. A lot of that. Any of our big emergency cases, we life flighted actually out to Sioux Falls. So I got to see the nursery report with the life flight nurse. That was interesting to see because, they come in and we stabilize them and then we send them off. So yeah.
Thanks, Katie. Can you tell us a little bit about how that telehealth worked? What kind of services were offered through that? And then if it was utilized outpatient and inpatient and what you got to see through that?
Yeah, so I never got to see them use it in an outpatient setting, but in the ER, it was connected to a Vera McKinnon. And so if a patient came in and they needed a specialty care, we would connect to that server to whatever specialty care they needed, like a cardiologist or an infection control doctor or whatever. And then the portable telehealth thing we would also bring in too, and it had a stethoscope attached to it and a camera. So if the doctor needed to assess the patient, the other doctor on the other side would the stethoscope up to the patient and the doctor on the other side could hear. And then the camera, they can show them like wounds and different things like that. So it's actually very cool.
Great, thank you. Helene, you're on mute.
Thank you, Katie, for sharing your experience. We're now going to move on to our subject matter expert for this conversation that we're having today. So Jason Plamp grew up on a grain and livestock farm northwest of Mitchell, South Dakota, where he developed a lifelong passion for agriculture. And after graduating from Mitchell High School, he earned a Bachelor of Science degree in Agriculture, Business, and Finance from South Dakota State University. And he also graduated from the South Dakota Bankers Ag Lending School and Graduate School of Banking at the University of Wisconsin. Over the past 2 decades, Jason has had his career is with First Dakota National Bank in Yankton, but he's also served in the bank's office in Salem, South Dakota, Sioux Falls, and then for the last 14 years, he's been in his hometown of Mitchell. And as an agriculture banker, Jason takes pride in assisting farmers, ranchers, and agribusinesses with their financial needs and bringing valuable insights into the challenges and opportunities facing rural America today. So thank you so much, Jason, for being with us here today. And we're just interested in hearing your perspectives about the challenges with economics in the farming community of South Dakota.
Sure. Well, thanks for the introduction and thanks for having me. I'll start off by saying I want to thank all of you guys for your efforts and not only that you put in, but the sacrifices that your families make. I'm a little tired this morning. My wife's a clinical pharmacist at the hospital here in Mitchell, and she got called in for an emergency, and so I was waiting up for her until about 3 o'clock in the morning. So if I look a little tired or a little off my game, that's part of what's going on here. But yeah, as you guys said, I've been in agriculture all my life. A lot of little kids grow up wanting to be an astronaut or a firefighter, and I always wanted to be a farmer. And so when I went to school, that was solely my goal, is I was going to be a farmer and come back and run the operation that my dad and his dad before him had been part of. And shortly before I graduated in 2002, my dad and brother took and sat me down, and they were both in the operation. They said, well, maybe we think you should go out and look for a job, 5 years, get some real world experience, and then come back to the farm and have something more to bring than just what you've got now. So I interviewed with Denny Everson at First Dakota here down in Yankton, and I told him, I said, I'll give you 5 years, but I don't want to string you along. After that point, I'm going back and I'm going to help run the operation. Well, now that I've been here over 22 years, I'm no closer to going back than the day I started, and it's been a good fit for me. I First Dakota is situated in southeast South Dakota, and my territory generally runs from the Missouri River east. And so a lot of the folks that you've interviewed today or that have been on here talking are situated right within my footprint and well within First Dakota's footprint. And we're predominantly agricultural country. Agriculture is an interesting business. It's kind of one of those things where you go out and you plant all your crops in the ground and you pray for rain and pray for good markets. And then 6 to 9 months later, you see how it turned out. So my typical customer is going to be, probably a 30 to 70-year-old guy that's got an operation. And most operations are, a few hundred head of cattle and a couple thousand acres of crop ground, and those two things are run together. We also finance some hogs and some dairy and the like, but predominantly cattle and grain are what we're financing. Some of the stressors that come into agriculture are, like we said, you put your crop in the ground, and I would typically one of the loans that I do is an operating line of credit. So we qualify people this time of year where they will come in and give us a business plan and kind of spell out what their needs are for the coming year. And then we'll get them approved. Your typical line of credit is going to be somewhere between $1 million and, upwards to $10 million. And they're going to take that money, then buy crop inputs, pay rent on land, buy machinery, and then go out and plant a crop in early May. And then that crop will mature throughout the year, and then they'll harvest it in November and see what happened. Some of the variables that can take place in agriculture that can cause financial stress are yield. Basically, the entire business is a simple function. It's price times quantity, and so the grain operation, even cattle operations, are largely commodities. So we're price takers. So our prices are determined and given to us by outside forces. And then the portion that we have a little more control over, but not ultimate control over, is what the quantity is. So through good agronomic practices, through good stewardship, we can do a good job of raising a good crop. But ultimately, those challenges that we can't control are, the weather, disease, and outside environmental factors. So right now, we've kind of been going with there's ag super cycles is kind of what they're called. And so about every 10 years, the agricultural economy, for simplicity, is basically on a big sine wave. We're on the downward slope of that sine wave right now. And, the ability to generate positive net incomes are more of a challenge than they've been the previous 3 or 4 years. So that adds a lot of stress to operations from the standpoint of, as I heard others talk about earlier, the cost of healthcare, the cost of insurance. We encourage our folks not to make those their chopping block items. Because they're so imperative to everybody's well-being, but they are things that come in to play. The other thing that I heard somebody say is when a farmer comes in, it's serious. Well, I would absolutely echo that. A lot of guys are going to try to bite their upper lip and bear down and get through it and not have to either spend the money or the time to go to the doctor, and they're going to look at it from a standpoint of I'm tough enough to get through this type of thing. And sometimes they'll lead to what I can see as bigger complications from that. Let's see. One of the things that's also a big deal in agriculture is it's something that's their farm is very attached to their personal identity. You'll talk to a lot of guys and their operation has been in the family for multiple generations, and they feel a connection to that operation, and they feel the success or failure thereof as a personal success or failure when that isn't necessarily the case. It's a business at the end of the day, and there are outside influences that that can be challenging, that aren't able to be overcome, or headwinds that, all don't face. So, by and large, it's a great part of the world to live in. It's a great business to be part of, and it does present its unique challenges. And with that, I'm probably the least qualified in my family to answer healthcare questions, but it can give you a feel for the financial flow of agriculture. So if there are any specific questions, I'll open it up for that right now.
Well, thank you, Jason, for sharing. And you say that you are the person here with the least knowledge about health, but really your role so affects the health and your communication. I can hear it in your voice that you're aware of some challenges that your customers have in trying to make those cuts and where the cuts are, and telling them that, to keep your healthcare coverage for insurance, that's not something they should cut. So you really do have a big impact on the health of the rural community of South Dakota.
Sure. Well, we try to, at the end of the day, we're all in it together. I mean, their success helps my success and helps Main Street's success. And so I think that the biggest thing that we can do as lenders is communicate well, and then be able to try to frame things in such a way that help folks to make the best decision, and to give them options. I think a lot of times when folks get really close to a decision that's a tougher decision to make, they feel like there are no good viable options. And that's part of our job, is to help them vet those out.
Are there any questions for Jason? And probably, Jason, we're probably not very good at economics and financial things either. We probably don't even know what questions to ask when it comes to this topic. So even though we kind of think our roles are separate, they really aren't. They really do interplay into each other. So thank you for all that you are doing for the farmers of South Dakota and the rural population. And if you ever need any assistance with that, be sure to ask us, and we'd be happy to help. And we'd even be happy to partner with you if there's ever any screenings or preventative healthcare items that we could do to help. We would be happy to. So thank you.
Thank you so much.
All right, Stacy, we're going to hand it back over to you.
Thank you. At this time, if there are any additional questions for any of our presenters today, you can feel free to unmute and ask your question. Alternatively, you can drop it in the chat and we can field that for you. So while we're waiting on that, Helene, did you want to cover this last slide, or have we covered this already?
I can
Yes,
do
this. Oh,
sorry.
thank you. Yep, Katie, I'll hand it over to you, Katie. Thank you.
Thanks. So we just want to reiterate that this was an all teach, all learn ECHO session, and the objectives for today were to examine those various healthcare challenges faced in rural communities of South Dakota, to discuss how financial instability may limit access to healthcare, poor nutrition, and other essential resources, and then also just to analyze the distinctive financial challenges faced by members of the rural farming communities.
Great. Okay, if there are no other questions, we are asking that you complete a brief survey for us today. You'll see the link on your screen. I've also dropped it into your chat. This helps us continue to develop important webinars for future. So your feedback is obviously gratefully appreciated. At this time, if there are no other questions, I'll give you another minute to grab that link. But we thank you again for taking the time to join us today, and for being here, for showing up, and for participating. Thank you all, and we look forward to seeing you next time.